Good afternoon, everybody. Very warm welcome to the PHUSE webinar Wednesday in the hot July of 2019. My name is Beate. I'm the Education Director for PHUSE. I'm looking into all topics that relate to education, and I hope you all saw the survey we did put out recently to find out about the needs of the community with regard to education of any PHUSE deliverables. And if you haven't and you would like to have a voice, don't hesitate also to touch base directly. So we have a tight agenda, so I'll try to be quick and then hand over to the other presenters. So Michael Harris. Michael Harris will give us an insight to the EU Connect conference that will take place soon in Amsterdam. Then we will have Ian Fleming, who is one of the working group leads of the emergent trends of the Educating for the Future working group, and he'll talk about the design thinking, where he's, I think, now evolved to an expert. Then there is a new project that will be presented by Andy, David, and Sangeeta, and that has to do with real-world evidence, what becomes a hot topic in the industry. And then finally, we will close off with Marcelina and Prafulla, who will talk about the Define-XML completion guidelines they are working on in their project. So I'll give you an update for the board of directors. So firstly, there is the upcoming conference in Europe in Amsterdam in November, from the 10th to the 13th of November in the lovely city of Amsterdam. And I would like to remind everybody that the early bird closes this Friday. So please make sure to secure your seat at the early bird rate. A lot of information about the conference is also out there on the PHUSE website, and Michael will give us more insight in a minute. Then you probably all saw that also the US Connect conference for next year was already announced. That will take place in Orlando, Florida. So the call for papers is already open and will close by September the 13th. So if you would like to share any of your knowledge inside to your work, please make sure you give it a thought and submit an abstract through the call for papers tool. Also, the registration is already open and the early bird closes on 18th October. There are also still quite some sponsorship and exhibition opportunities open, so that's all available on the PHUSE website. So there you can find more information of what's out there. And if you're interested, the PHUSE office is always there to help you out. Also, PHUSE, as usual, is running single-day events throughout the year. So there is one upcoming now for August in Mississauga, Canada, on August the 15th. And I think it's a really exciting theme with data-driven decision-making in a dynamic landscape. And dynamic is really what we are seeing in the industry at the moment. Then you probably all know that the, PHUSE is running a lot of projects in parallel, and they're always looking for volunteers. And if you check out what's published on the PHUSE web, I'm sure you will also find things you're personally interested in. So there are many things out, and concretely, there are 2 projects who are currently seeking for additional help. And one of this is the integrated SDTM and integrated ADAM reviewers guides. So they are looking not to create reviewers guides for single studies, but creating a template, completion guidelines and example documents for integrated SDTMs and ADAMs in multiple studies. Furthermore, there is a project that was initiated quite some time ago already. That's good programming practice tailored to macro development. I guess there are quite some technical guys out there who might contribute to this project, and they are also seeking for volunteers. So with the slides that will also be available after the webinar, you can also check out with the links provided here what's out on our website. And if you're interested to be part of any of the PHUSE project, please contact the working groups at PHUSE.eu. Then more continuously, PHUSE volunteers also put together deliverables that then first go out for public review before they get finalized. And that's a really good chance to have a say and share your point of view. So not just for these ones which are currently out for public review, please make sure you check what's out for your review and that you can contribute and also help shaping the industry. So concretely, currently the public review is out for the recommendations of anti-drug antibody data modeling in SEND 3.0 and 3.1. There are also a lot of material out for that was published also recently, material from the CSS conference in June in Silver Spring. Specifically, there is a recording of the safety analytics workshop. If you're interested, the material is there, have a look. Also, there is regular news put together. So we now have the summer edition of the working group news that's published. So if you would like to learn what's currently going on in the working groups, that's all shared on the website. Also, what new projects have started and which deliverables have been published. For example, since beginning of the year, there are 6 new deliverables that have been produced. Also, if you're interested in writing an article, so then consider signing up to the weekly blog to get the latest news and information. And finally, and that's also closing quite soon, I think that's next Wednesday, July the 31st. So we do have some vacancies on the PHUSE board of directors. That's a routine that every 2 years we those positions get opened. But eventually also those who currently having the role apply as well. So we are looking for a collaborations director who would ideally based in the US, because this guy would also be the link between PHUSE and the FDA. We are looking for a director for EMEA who is EU based, of course. The memberships director position is open, the special director's position is open, as well as the operations director. So if you consider to apply, be quick and send us your application by next Wednesday. So finally, the next webinar will take place on the 25th of September. So there will be no webinar in August because it's vacation time. The webinar will take place at the same time as today. The agenda is going to be announced and will be provided also via emails. If your colleagues missed today's webinar, so the webinar will be recorded, and the material will be available as well as the slides. And if you have any questions throughout the webinar, please use the chat and Lauren will look out for them and we try to answer everything at the end of the webinar. And now I hand over to Michael. Thank you.
Thank you, Beate. So before I get started, I'm just going to run through a few details. So firstly, just to remind you that the EU Connect is from the 10th to 13th of November. It's going to be in Amsterdam. At the venue is the RAI Amsterdam, which is located in the Financial Mile, or the Swedish Business District. Planning has gone really well this year. Really pleased with all what's happened. We've received a record number of abstracts, which is actually a record for a PHUSE conference. So it's just shy of 300, which effectively translated into 150 presentations in 19 streams, and we have a little off 30 posters. So the actual conference agenda is pretty much finalized now, and I'm going to run through a few details. So I'm going to go through the agenda, which is I'm going to give you some info on the keynotes, the new streams that we have this year, the hands-on workshop, the discussion club, the poster session, and I'm going to run through some key dates. So happy to announce 2 of the 3 keynotes, one being Sleep and the Ways of Measuring with Dr. Neil Stanley, and the other is The Data of Fluffy Stuff and the Battle for Sanity with Simon Shepherd. So just to give you a bit of background about Neil, he's a freelance sleep expert and the author of How to Sleep Well, and he's been involved in sleep research for 37 years. And going on to Simon is, or shall I say, he has a methodical approach that challenges individuals and teams to assess their performance, behavior, and with over 1.5 billion data points at his disposal, he underpins messages with science, bringing the concepts of key human performance indicators to life. So for more details on those, there is information on the website. As I say, I sort of don't want to steal their thunder, but that's just to give you a bit of a taste of what they're going to cover. And the 3rd keynote will be announced shortly. So onto the new streams that we have. So in a previous webinar, I mentioned these, and the thing that was different about these new streams is that they're actually dual formatted. And by dual formatted, what I mean is there's going to be presentation elements as normal, but there's also going to be a hands-on session. So looking at professional development, leadership and innovation, and personnel management, for the professional development hands-on session, it's going to be described as putting ourselves under the microscope, exploring professional identity and well-being and impacts for career development. So the aim of the session is to capture ideas for growth and development and to explore opportunities and difficulties that may act as barriers or enablers to your onward career trajectory. Sessions are broken down into 3 parts using academic theory and interactive exercises. The leadership and innovation is actually going to be a follow-on from the keynote. So it's going to be in and around sleep. So it's going to be how to effectively measure sleep in clinical trials, why big data is not always the best answer, and the challenges of new technology, illustrating the perils and pitfalls of measuring sleep on clinical trials. So for this hands-on, the session will comprise of group breakout sessions, group feedback sessions, and a wrap-up. And finally, onto personnel management. This session is going to be around the use of the 9-box tool to identify high performers and candidates ready for promotion, as well as underperformers, and then to use this information to put succession plans in place. So they're going to be using fictitious profiles of team members. So there's going to be almost like an element of role play involved, which should be quite humorous. Moving on to the hands-on. So we're going to have programming in SaaSfire, facilitated by Amadeus. So for those of you who don't know, SaaSfire is the latest platform from SaaS, providing cloud-enabled analytics that's both elastic and scalable. So data is held and processed in memory, providing super fast access and processing of data. It also allows integration with other programming languages such as Python, R, and Java. So this workshop is designed to help existing SAS programmers understand the features of the VIA environment and how it differs from SAS 9 and the benefits afforded from programming existing operations within SAS VIA. So the workshop will include demonstrations of the coding environment, interspersed with opportunities for participants to try out programming features during the demonstrations. Let's make knowledge a graph. So that's going to be facilitated by UCB Biosciences and SQ. So the term knowledge graph and fair data are gaining popularity in our industry, but what are they and how do we apply the technology and mindset to solve our data and standards challenges? Both concepts are built on the foundation of linked data, which provides meaningful semantic relationships between data values as well as the capability to include metadata rules and standards. In the session, you will use a web application to diagram relationships for clinical trial processes and data, and then convert your whiteboard drawing to a resource description framework, an RDF. You will then query the data and then seamlessly merge it with the data from all other attendees. An ontology and reasoner will infer values and the relationships not in the original content, and your data will be augmented using freely available open sources, including clinicaltrials.gov and DBpedia. Insight into Python facilitated by Medidata Solutions. So this is going to be a hands-on workshop with Python. Python is an increasingly popular free programming language, which has widespread adoption across the scientific community. One of the biggest drivers for this is the use or the ability to be able to supplement tools such as SAS or R, or even SAS VIA. So it can be used, but it can also be used as an analysis tool in its own right. So the workshop will just give an overview, then look at machine learning and analysis on using the web APIs. And the final workshop is on deep learning for humans, brought to us by HMS Analytical Software. So, and artificial intelligence has made its way into everyday lives of almost everyone, be it through self-driving cars and communication, smart speakers, etc. One of the driving concepts behind this progress is deep learning. Deep learning is based on powerful enhancements of artificial neural networks, which have been used in machine learning community for a long time. Deep learning methods have the potential to support R&D processes in our industry. After a brief and informal overview of deep learning, the underlying machine learning concepts, the participants will dive into prepared worked examples. Finally, on the interactive hands-on type sessions, we've got a discussion club, which I'm proud to announce, which will be featuring the EMA. So we're going to talk about the current efforts from regulators and other organisations to enable data sharing, and then the EMA are going to give a presentation on the status of Policy 70, followed by a Q&A and a panel discussion. The poster session. So following on from last year, we're going to have the poster teasers again. So they're 30-second sound bites from the authors giving an overview of their works of art. This should give you an insight into what their posters are about, and it will help target which posters you wish to see ahead of the conferences and which authors you'd like to speak to. Links to the poster teaser will be sent out prior to the conference, so please look out for that. On Sunday evening, we're going to have our poster session, our sort of main poster session as usual, followed by the week welcome event. And then on Tuesday, there is also going to be an additional poster session, a kind of a mop-up in case you didn't have an opportunity to speak to the authors. Onto my final slide. Just to remind you that the early bird deadline is this Friday, so that's the 26th of July. Just to make you aware that the hotel PHUSE rate deadline, so PHUSE have organised the hotel for us, basically need to book your spot by the 30th of August to be able to get this reduced rate. And please go on the website or use this link to be able to do that. And my final words are really just to say, I hope to see you in November. So the conference is the 10th to 13th of November. Over to Ian.
Okay, thank you, Michael. I should be sharing my screen now, so hopefully everyone can see it. So I'm going to be talking a little bit today about the CSS and some of the work that the Educating for the Future team did at CSS. So we decided to do a design thinking session on ourselves, essentially. So we've done a number of design thinking sessions with other groups to help them understand better some of the problems that they're facing and come up with quick solutions and things like that. So what we decided to do was kind of turn the lens on the working group itself to actually see if there was any way that we could improve how we were delivering our material, or if we actually could understand our users any better. Could all the other presenters go on mute, please? I hear some breathing on the line. What we decided to do was we started with Sunday night, where we actually decided to do a bit of a user group session or an empathy session with a number of different people to help understand, how they learn and how they wanted to be educated and different things they wanted to be educated about. And so what we did was we had a meeting room in Silver Spring, and we broke up into 2 groups, and we had 2 interviews per group, where we actually started asking a bunch of different questions around how people learn, what motivated people to learn, like what were the different pain points in learning new concepts and things like that. We learned a lot of really interesting things. One of the things that we learned that we weren't necessarily expecting to learn was that there was a little bit of confusion between education and training. And so I think a lot of people really assumed that, or kind of made the link between those 2 things to say that there was training that was a part of someone's job. There were requirements, and they kind of assumed that is what education was, rather than going out and learning something new, or if I wanted to learn about machine learning, I wasn't prompted to do so by my boss. Right. There was a lot of people who were reluctant to kind of just learn things on their own. There was a tendency to only learn new things when they were told they had to learn those things. So that was an interesting finding. We also discovered, which shouldn't be surprised, we also discovered that a lot of people tended not to want to change unless they were a part of the change. And so they didn't like having change imposed upon them, but they actually like to be a part of it. So these are all some interesting things that we learned that we took into the next section, which was actually building out an empathy map, trying to understand the users and figuring about how they feel about education and what spurs them to do these kind of things, and just trying to learn the user community a little bit better. So what we did then is, once we took all this information, we decided to define what our problem statement was, and we did an exercise called How Might We? So how might we build a community? How might we authenticate the training that people are getting? How would we build a sense of urgency? How do we actually handle the change management associated with a lot of this, because a lot of people don't kind of do this on their own. So how exactly do we help people through that change curve? And then lastly, I think the one that we really settled on as the one that was the most important was how exactly do we inspire people to go and get educated, or want to learn something new, or try to tackle big new problems. And we did a lot of Post-its and everything, and we did a lot of voting, and now the Inspire one was the one we focused on. And the problem statement we ended up with was, how do we inspire people to learn and experiment to shape the future of medical research? And that's what we really wanted to do, was we wanted to actually foster a place of experimentation, and we also wanted to help people understand that they were a part of this change, and that the future of medical research was really only going to happen with their participation. So what we then did was, once we had that problem statement, we were like, okay, how exactly do we tackle this? How do what is the solution to actually help people get engaged and involved here? And so we came up with a bunch of different solutions. So you can see here on the top, across the top of the filter there, these are a lot of the different solutions that we came up with. And what we ended up with at the bottom was a solution that we all voted on, and everyone agreed to it. And then what we did then was we actually decided to build a prototype. And I can share that prototype with you now. So the prototype is here. This was built in a tool called Figma. Keep in mind that Figma is a rapid prototyping tool for building visual prototypes. And so what we have here is something that is intended to be not a full-fledged solution, but it is a lot of visuals, and it is intended to actually help us test out some of these things. And the way that we did that was we presented this to the entire CSS at the end, and we actually asked people to give us feedback. So what we have here is, if anyone's ever heard of like the X Prize or Kaggle for machine learning competitions, what we just settled on was basically like a competition space, where what we could do is we could actually present challenges, and the community could engage in trying to solve those challenges. So for example, here we have the landing page, and one of the challenges could be like next generation submissions. Like how, what exactly does a next generation submission look like, and how do we actually challenge the industry to try to tackle this, with some kind of an incentive. So if we click on some of the challenges here, if you've ever seen Kaggle before, this is kind of a very similar screen. So what we have is a number of active challenges. We have the ability for people to suggest new challenges. We have challenges that are under consideration, and then we have challenges that have actually been closed, ones that have been tackled already. We discussed quite a bit about how exactly we would adjudicate these things, because I think we wanted to make sure that these challenges were big ideas. We didn't want a lot of very small things to come up, because they were kind of regurgitating a lot of old ideas. We really wanted to set big challenges in the, in the vein of like an X Prize. There really were things that would encourage people to get involved, and not necessarily just people from our industry as well. We really wanted to bring in people from outside the industry to bring in new ideas and new thinking. And so here are some of the ideas that we talked about. So things like fully traceable data, a review portal, collaborative review portable with regulatory agencies, fully electronic protocols, all kinds of things like this. And so these are just some of the ideas, but the idea would be that once people suggested new challenges, there would be a panel or some kind of a committee or something that would adjudicate these things, full of multidisciplinary people from within and outside the industry to actually decide which ones went up here. And you could actually choose what the incentive was. So kudos just as saying like, hey, yeah, you solved the problem. We discussed for quite a while the idea of money as an incentive. So for example, if, I don't know, some company, J&J, whoever came in and said, this is a problem that I really care about and I want to put some money behind it, I want to put $1 million behind this to whoever can solve this problem, I don't see any reason why, that could be a problem to actually do that. I think that would actually be a good incentive for people to kind of come in and actually start solving some of these things. So if I just click on one of these things, well, you can see some details about it. So you have a description of what the problem is. Success criteria is actually very important, because the success criteria are the things which decide whether you solve the problem or not. And if you look at the X Prize, the original X Prize was basically a commercial, basically challenging anyone to send a spaceship to space and back down again. But there are success criteria to say that you had to use the same exact spaceship, and it had to go to this particular height that was considered, quote unquote, space. And you had to do it twice within like a 2-week span using the same spacecraft, right? And so those are very clear criteria. And there was a company that actually, I think Spaceship One was the company that won that, and they met that criteria. So the success criteria is going to be incredibly important here to make sure that if we wanted to do this, that when someone met this, it was, validatable, and it was clear that they actually met those things. Constraints. Saying that, if there was any kind of constraints that you want to put on this, to say that it needed to be done within a certain time frame, or it needed to be done in a certain language, or not in a certain language, or whatever. Those are different things you can put in here, as well as a timeline for the challenge. And then we could actually have teams over here. And so, for example, if I click on any one of these teams, I could see a team here that is a multidisciplinary team. There's a number of different items on this page. So you could say that the team is recruiting new members or is not recruiting new members. It would have a link out to, for example, their GitHub account, and you could see the number of commits that's actually happening over time. You could see the technologies that this team is using to actually solve this problem. And then you can see some of the team members. And we decided here we wanted to incentivize, multidisciplinary and multi-industry type of team members. So we have people from regulatory at the FDA, people from industry here, and then someone from academia, and then also someone not from our industry who, when we did this, Johnny Ive did work at Apple, but as of now, he actually doesn't work at Apple. So this is a bit of an old slide. But the idea here is that we're actually pulling someone from, not our industry to actually work with this team to maybe inject some new ideas and some new thinking on some of these things. So we presented this to the end of the CSS to everyone, and we asked everyone to get back to us with some feedback. I don't have the feedback here, but I can tell you that we received something like 15 plus responses, somewhere around there. And I think it was overwhelmingly positive. I think a lot of people thought that this was a good idea. And so I think the next step with this is to, talk with the PHUSE board of directors, talk with, Lilian Rosario at the FDA or other people at the FDA to see if there is any kind of way that we can move forward with this, either within PHUSE or outside of PHUSE, or how exactly we can do that. So there are some discussions ongoing with that. And I guess we'll keep you updated as to what comes up with that. And with that, I will hand it back over to Andy.
Thank you very much, Ian, for that interesting presentation. And thank you, Lauren, for putting the first slide up. I'm Andy Richardson, and today, together with David Hood and Sangeeta Bhattacharya, we are taking the opportunity to introduce you the new Real-World Evidence PHUSE Working Group project. Before I hand over to them to discuss some more of the project in detail, just I'd like to start with a brief history. The project is really very new indeed. It was initiated about 8 weeks ago, following the successful Real-World Evidence single-day event that was held in London, and a recognition by PHUSE that there was no particular focus for focus project that was considering real-world evidence issues on behalf of members and others. As you can see on the slide, the principal goal in summary is for this project to explore the challenges of using real-world evidence in support of regulatory submissions, and we are pleased to say that already we have a very comprehensive set of people on the team who have both direct experience, interest, and coming from different points of view to support the project in this space. And as with all our projects, those who are on the call or even not on the call who listen to this later, if you're interested in contributing, I'm sure we'll be pleased to hear from you. To make sure that the project reaches considered and comprehensive outcomes, we've also recognised that the broad applicability of using real-world evidence or real-world data in support of real-world evidence in submissions is going to be a topic in many other of the work streams and the projects. And so part of our initial goal here has been to ensure that we're also working alongside and cooperating with other PHUSE projects, such as the data engineering project, which is looking at the issues of data sources, machine learning and blockchain, and other areas that also impact on this, on real-world evidence. We're at a very early stage in the project, and I'm very pleased to report that David and Sangeeta have kindly volunteered at this point to be co-leads to take the project forward for the next phase. And I would now like to hand over to them to discuss in more detail the objectives and the next steps. So I will, if we can have the next slide, please, Lauren. And I'm not sure who's speaking to this one, but if it's David or Sangeeta, please pick up the presentation baton.
Thanks, Andy. This is Sangeeta. And I'm really excited to put on the hat of the co-lead for this project. As Andy mentioned, we are 2 meetings old, but I think we have gotten a lot of exciting information and a lot of good input about the project. I'm Sangeeta Bhattacharya, and I am the Immunology Statistical Programming Head in Janssen Pharmaceuticals. So one of our first deliverables that we are thinking is to have a white paper, and we have put together, I think, a pretty ambitious deadline of December 2019. But we got a lot of good input from our team in the early days, and we are thinking that the white paper would be considering the following topics: real world evidence and data sources. How are we getting the real world evidence data? There is FDA draft guidance out on how to include the real world evidence data, and talks about how we can use the real world evidence data as a control arm. And although I think we have passed the formal period of submitting our comments back to the FDA, I think Andy is looking into seeing if we could have a liaison with FDA, and definitely we are going to work with FDA in providing our comments and further finalize the guidance. We will also talk about the submission data structure. So having gone through some of the experiences of some of the team members in actually utilizing real world evidence data as part of their submission, many of them have shared that they did have to convert it into ADAM data, and we are just going to explore if yes, and what could be the requirements. Of course, high on our list is the privacy elements. So for the USA, we have to be HIPAA compliant, and for EU, the GDPR compliance. So we are going to explore that. So the other topic was around the electronic health records and how, you know, it kind of impacts the real world evidence data. And then we are very keen to learn the lessons learned, the success and failures from our team members. So we even have a working title that you can see on the top, you know, basic considerations for the use of RWE data in support of regulated clinical trial submissions. And if anybody is interested to contribute, you can definitely contact us. Here's the email address. And with that, I will hand it over to my co-lead, David.
Thank you, Andy. Thank you, Sangeeta. David Hood here. I'm in the specialized programming group within RealWorld Evidence at Pfizer. And as Sangeeta had mentioned, I'm the co-lead for this work stream. One final quick slide here, just highlighting some of the next steps we have in mind. So the most immediate is getting together with the group and reviewing the FDA guidance. Andy kindly got together 4 or 5 different links with what is existing so far in the guidance. So we're going to review that, make sure everyone's on the same page. And one of our, I think, main goals with this work stream is to hopefully be able to work together with the FDA and contribute towards that, establishing these guidelines. It's still in the early development, so that's part of why within the white paper we have the lessons learned section. The more we can share our successes and our failures, we can guide our own work streams within each company to most utilize efficiently and effectively our real-world evidence in support of submissions. So after reviewing the guidance, we're going to assign the different topics in the white paper. And I think after this initial white paper, the different topics will eventually become larger topics within themselves. The first paper will be more of an overview, what we see coming on the horizon, the most important issues, and then down the line we'll end up delving deeper into the more pertinent issues. And yeah, so the future state will be, like I said, delving into those issues deeper, and also just a general knowledge share, mostly how we're working with the FDA as the guidance evolves in these early days. So that's all for our group. Again, I'll just say for the third time, since we are young, still trying to get the word out, I'm sure if you're interested, feel free to contact us. We're happy to take more members. And I believe I'll pass it back to Lauren.
Hello, can you hear me?
Yes.
Okay, do you see my screen?
Yep.
Okay, thank you all, and thank you for having us here today and for your time. Prafulla and I will go over the Define-XML version 2.0 completion guidelines that was delivered last month and published last month. I will go over a brief introduction, and then Prafulla will proceed with a few examples of guidelines and that have been covered on the document and particular examples, plus a follow-up process. Trying to be brief on this summary. Some of these slides have been put together so that you can have a handy reference in walking through the document, but pretty much giving you some basic ideas of what was taken into account when preparing these deliverables. The document itself, completion guidelines, and shorthanded CGS on this presentation, was intended for users familiar with the Define-XML 2.0 standard, plus data content standards, CD's data content standards, and an underlying control terminology. This is important to bear in mind because the document itself refers to metadata concepts. There is no XML code included in here. And again, the idea behind it is that it's very, very difficult to convey these and trying to reach the goal when we just dive into the technical aspects of this. We understand that organizations have individual groups that handle the technical aspects of this, but we thought that in order to really prepare a data definitions document, there are some concepts that perhaps have been the basis for many issues that have been surfaced when preparing the documents. So this document pretty much was intended to go over clarifications and examples on metadata items that have been proved to be challenging for the user community. And this is not to rephrase information that is contained in other documents, standard documents or guidelines. It is intended again as clarifications and simple examples that hopefully we came up across and help avoiding a few common mistakes that we have been seeing and have been all along presented by many, many different stakeholders. And one of the goals is improve consistency on metadata submission. Hopefully, again, we will be helping the user community with this delivery. As a handy reference, we included this slide, which is a Define-XML standard, basic ideas. And this is a machine-readable document. The Define-XML standard helps prepare a machine-readable document. And the version 2.0 specifically does not include presentation metadata. It again depends on a software viewer, like a study sheet, for any presentation purposes. So all of these considerations have to be taken into account when reading the document, and hopefully the document explains in more detail this kind of basic ideas behind guidelines or examples. The Define-XML is for multiple use cases, but the primary use case is the one that we have taken into account when preparing these guidelines. And the Define-XML for submissions, one concept that we would like to stress over and over again is that this is not about preparing the Define-XML just at the right minute to send this out the door to the regulatory authorities. This is about defining your metadata, and the metadata starts from date one, planning proposals, planning stage. So we certainly recommend to develop data definitions well in advance, upfront. And things that might deviate from the plan can be documented along the road, and in one way or the other. The Define-XML offers different mechanisms for this documentation. So hopefully the guidelines will help understand and resolve a few issues that might have been pain points along the development of or the implementation of Define-XML. A practical link in here, where to find this document. You go into the PHUSE website, and under the section white papers, which not necessarily we consider this a white paper, but it was placed under this group of documents. And you will look at this. This is kind of a table that is in there. You look at the section that on the table that discusses about, that presents the optimizing the use of data standards deliverables, and you will see the Define-XML version 2.0 completion guidelines. Specifically, again, this is for Define 2.0, and we understand Define 2.1 is out there in production. Hopefully, users will go into implement the version 2.1. But conceptually, I think anything that was presented in these completion guidelines would help with any concepts that are in Define-XML version 2.1. So hopefully we had accomplished that, because we kept the 2.1 standard in mind when documenting these examples and guidelines. When you go to the document, there is a handy set of bookmarks that hopefully going through the how to use this document 1.3 section in there will help you navigate the document. It's a long document, but if you're looking for something general, go to the first section, and then you can go in detail on any of the main sections on the completion guidelines details. Section 2, which is broken down by each of the main topics of the metadata definition. These are details of main ideas when navigating the document. We have components of metadata, of whatever metadata tables for each of the main sections of metadata. And an important item, nomenclature item we use in the document is one called metadata item. We had debated with how to document these, and again, since the audience for these guidelines and examples document is users familiar with Define-XML, and the idea was clarifying metadata concepts that might not necessarily be discussed by the end technical teams. We needed to prepare these or discuss these in terms of a reasonably understood nomenclature. We call it metadata item, and that hopefully is presented in a way that can be clearly differentiated from the technical element or attribute that is referenced in the standard. And in particular here, guidelines were developed for cases where, where the the team considered a good best practice was needed, but is not included in any other guideline document that is in associated teams or teams deliverables like standard implementation guides or metadata submission guidelines or technical conformance guides, etc. So in that sense, these are in addition to anything that can be found out there. And for guidelines developed by this specific team, each guideline includes both a rationale for why it is intended as a best practice, as well as one or more examples. And before passing the floor to Prafulla, I really would like to express our gratitude to the complete development team, each of anyone that had contributed to this deliverable over the past 3 years. That help us very well is very well appreciated. We couldn't get to this point without all the interaction, all the discussions, all the vetting and everything that goes along with something like this. On the right column, you might see the different groups that have been represented and different organizations that might have been represented on the middle column. So again, thanks a lot to each of it and every one of you. And for those that are not explicitly listed in here, because there are so many, please refer to in the document, we have the link to the specific PHUSE page that includes the names for everybody that have contributed over the past. So with that, Prafulla, please go ahead.
Yes, thank you, Marcelina. I'll try to go over as fast as possible. So the table you see here is within the document. You will notice at several locations, we have a table that reads as components of, I think we just went back to Marcelina.
Apologies for that.
Can you go back?
Apologies for that.
Okay.
It's back.
All right, no, that's fine. That's fine. So components of, in this case, it says value level metadata. So you will notice a table like this for different types of metadata. And within this table, if you notice the first column where it says metadata item, as Marcelina mentioned in a previous slide, that this is a name that this team decided to use in the context of this document. For example, if you look at where condition, instead of calling it a where clause, it is called as where condition. So that is the convention, the first column used within this document. And then we also have the last column, which is the Define-XML specification reference, where you will notice the actual XML element or attribute name that maps to that particular metadata item. And simple examples are provided in the example column. Next slide, Marcelina. Okay, so Marcelina mentioned about the guidelines. So in the context of this document, when something is specifically called as a guideline, what this team intended to do, as Marcelina mentioned, is basically anything that may not have been explicitly documented in other published documents out there. But this team decided to put it out there as a guideline. And then anytime there is a guideline mentioned in this document, then there is a rationale provided. For example, this is in this case a value level metadata. When you have a value level metadata that is same for different value level metadata values, then you can collapse it using an in operator. In this case, systolic blood pressure, diastolic blood pressure, both have the same metadata item. So they are collapsed using the in operator. So that's just an example of a guideline with example. Next slide. And this is an example without a guideline. So something that may already be out there, but needs further clarification or needs additional example. A common mistake that users may be doing. For instance, in this case, a lot of times tendencies to only report the values that are present in the data for control terminology. But the expectation is that all the allowed values that are planned in the study should be documented in the Define-XML. So the intent of providing these examples is to further clarify that. Next slide. Okay, and the last thing, the follow-up process. So what we would encourage everybody is that as the guidance documents are evolving, such as Define-XML specification next versions coming up, CDISC IGs or technical conformance guide, if anyone notices a conflict between those documents and what is documented in this completion guideline, we really encourage that you provide that feedback. And we have provided the email addresses here where you can provide the feedback. And a huge thank you to all the teams that Marcelina mentioned who contributed this project. This was impossible without the team efforts. So I think that's pretty much what we wanted to cover. Thank you so much for the opportunity.
Thank you everyone for presenting. So we have a minute left. If you have any questions, please do submit them in the question box. We haven't had any questions come through just yet. Just whilst you're doing so, just to echo what Beate said, there will be no webinar in August. So our next webinar will be held September the 25th.
And I would like to echo what the team just said. So a big thank you that sometimes gets lost for everybody who is volunteering and contributing to any of the working groups or to submitting abstracts to conferences and so on. And that goes to everybody on the call and also to your colleagues in your companies. Thank you.
Okay, we haven't had any questions come through, so all that's left for me to say is that wish you all a wonderful summer and thank you very much for joining.